I am going to kick off, in addition to we have many dignitaries and special people here, but I did want to recognize a few in the audience. The rest you can meet as you walk around, just talk about who you are, what you do. But I would like to introduce our leadership panel. These are the leaders of the various organizations that help support patient advocates, health advocates, hospital advocates, case managers. My new term is the helping professionals. We're all helping professionals to help people navigate this complex healthcare system. So first, I don't know if you can see their names, but I'll read who they are, and you'll know who everybody is. And after this is over, I really want you to get to know them. I want you to talk to them, let them know what your needs are and how you can help. We all have to be active in this practice to help it grow and to spread the word of what we do. So first, in Chair 1 is Brad Schwartz. He's representing Greater National Advocates. They're all going to talk about one thing that nobody knows about them that will make you smile. Brad?
Would you like the microphone?
Yes, please. How do you spell Amani?
I'll show you.
It's important for this.
Oh my God, no, okay, just start talking.
So, okay. I just asked how to spell the name of the gentleman from Saudi Arabia. Amani, right? So the one thing that nobody knows about me is the fact that I have a record label, and one of my artists is named Imani. And so it's interesting. Thought I'd throw it out there.
That's funny.
Talk to me about it. I'll tell you how to get. We're getting ready to release a soundtrack album.
Really?
Yes. My brother's a documentary filmmaker. He made a movie about the west side of Chicago, and my guys are the soundtrack of the streets. There you go.
That's going to be hard to follow up. Next is Kim Pedersen, who is representing the Burrell Institute, Patient Experience. And Kim, what's your secret sauce?
So this is going to show my age. When I was a 6-month-old baby, my parents were very young, living in Tennessee, and ran into Elvis, and he kissed me on the forehead. I haven't watched it since.
Oh.
Yeah, so there you go.
There you go.
I think everybody's going to be in the music industry. Next is Colleen Morley, who is representing the Case Management Society of America, and she is also handling all the continuing education credits for this conference.
Yeah. I'm your new best friend today. It's not a secret because it's all over Facebook, but you guys probably aren't on my Facebook. All of my children are professional wrestlers.
Oh, wow.
My daughter is a retired professional wrestler before she became a chef. She met her husband, who is also a retired professional wrestler, at a match. They did not wrestle, but she did call dibs on him that night. My oldest son holds 3 tag team titles in 2 states and a singles title. My youngest son is training to be a professional wrestler, but he has been a professional wrestling referee for the last 3 years. And Mom is the bankroll for all of that.
And then next we have Heidi Kummer, who is representing the Patient Advocate Certification Board.
Thank you, Ann. Well, it's a little hard to follow these fun facts that we just had, but I guess something that nobody knows about me is I collect copies of The Little Prince in different languages, and one of my favorites is an edition in Latin.
Wow.
Next is Stacy Batista, who is representing the National Association of Healthcare Advocacy.
Thank you, Ann. So my little known fact is that I met my husband the second day of freshman orientation in college. We were at the president's house having lunch on the lawn. I'm there with my tray, walking, thinking, who do I go sit with? and I see this man, off over in the distance, and I swear to God, he had a halo over his head. That was it. 35 years later, we're still together.
Great.
Yeah.
I think we have to turn this on. I don't know if this is on.
Next is Deb Feldman, who is representing the Aging Life Care Association.
Good morning. Whoa, okay. Before I was like concerned that you couldn't hear everybody from that smaller mic, and wow, this one's really loud. I was trying to come up with something anecdotal about myself. I don't know, I really like, this question comes up often and I never have an answer for it. So I suppose the biggest thing and the cute story is I like to cook. And I was always into very healthy foods and that's just always been my lifestyle. So growing up, my children would ask, what time is dinner? And, I work full time and I had to buy fresh food, and so I would get to the grocery store and finally get home, and I would say dinner will be on the table at 6:30. Never was on the table at 6:30. It was always at least 30 minutes later, if not 45. And then the cutest story is when my daughter went off to college, she said, her friends would go to all these fast food restaurants. She never knew how to order food from them because she never really ate at fast food restaurants. And the compliment to me really was just the fact that they really did appreciate the fact that they had home-cooked meals all the time. So I will pass the baton on after that.
Our next leader is Robin Shapiro, representing Health Advocate X.
Thanks, Ann. Good morning, everyone. So my story, some of you know this. My very first job was in Washington, D.C., working for Ogilvy and Mather, where we wrote, and I was a contributor on the first letter from C. Everett Koop, who was the Surgeon General at the time in 1988, to every household in America about AIDS in the year that that was the #1 fear on Americans' minds. So I was very happy to contribute back then.
Wow. And our last two leaders are the exiting and the incoming leaders of the Alliance for Healthcare. Let me see this. Alliance of Professional Health Advocates. Advocates. Yeah. And we have Deb Gordon, who is the incoming, and her partner could not be here today, so she's representing Dina and herself. And then the renowned Tricia Torrey.
Good morning, everyone. So I don't cook. I don't think I've done anything remarkable, and I have no great side gigs. But my fun fact, I have some good weird ones. The beauty of being so new is nobody knows anything about me, so anything I tell you will be something you don't know about me.
Right.
When I was a kid, I was into acting and theater, but I knew I was like very practical, so I knew it wasn't practical to want to be an actress, so I wanted to be an anchor woman. Super practical too, but so this is kind of a thrill. It's like, that's, I got more, but they just get weirder from there.
Good morning, everybody. I have to tell you that I am so thrilled to see so many of you here, and I thank you for being brave enough to come through this pandemic and just to be here to support each other, because don't we need it? I've seen so many people today from the Brady Bunch, right? Zoom? Everything's the Brady Bunch. All right, so little known fact about Tricia. In 1977, I was on the $20,000 pyramid. The two things you need to know about that is it was 1977, and it was only $20,000, which then seemed like a much bigger fortune than it seems like today. I actually was on the nighttime version, so you only got to play twice, no matter how much you won. I won both games with Ann Mira. You remember Ann Mira? Yeah. Ben Stiller's mom, for those of you who are too young to know Ann Mira. And we went to the pyramid twice, and I won $1,200 in total. And we literally, those were the days before DVRs and VCRs or any way to record, right? I do have a recording. I can't tell you how I got it. I'd have to kill you. But the fun part was that at the end of it, she stood up and she gave me the biggest bear hug I have ever had in my life. And she was a tiny woman. But it was so much fun. It was one of the most fun things I've ever done. Yeah.
Oh, wow. So you can see the many talents our leaders have. And they've all stepped up to help you, help the industry, help patients do well in the healthcare system. So we're going to ask some questions. The goal of this is to be interactive. We do want anybody who wants to ask a question of the panel to come up. Are there microphones? We're going to have some microphones for you. So we'll just ask you to come up the center aisle, this aisle right here by Michelle. If you want to ask a question, you can come up during when they're speaking and we can take your question. So feel free, don't be shy. Come up, ask a question. This is here for you, right here, thank you. And this is for you, this session, because we want to be aware of how we can all work together. So the first question, and each member of the panel will be able to answer if they choose, and then be able to give a brief overview of what they think. But again, we want to hear from you too, so feel free to come up. Okay, so the first question is, was there one improvement, insight, silver lining for your organization arising from the pandemic? Brad?
Yes.
Boy, that was short and sweet.
I follow instructions.
Wow.
I think the pandemic, we're gonna look back in 15, 20 years and it's gonna be a big old silver lining because what it exposed and what it taught us. Silver lining specifically for Greater National Advocates was we buckled down, met more people during the pandemic, and I'm seeing them in person the first time than I met in person in the 5 years before. It brought every group together. I think that you're gonna all realize that for the first time in a long time, there's a lot of unity in this profession. We're all starting to figure out what everybody's good at and what we do, focusing on our strengths, coming together. So, I mean, we just buckled down. Courts were closed. So, I mean, uber focused. That's my answer.
Yeah. Kim?
So I'm here representing the Beryl Institute, and I'm also a director at Northwestern Medicine Healthcare Facility with bulk of my work around patient relations. But I wanted to say the Beryl Institute, part of what they do is collect the voices of all people that can impact the human experience in healthcare. And that's all of us. That's patients and families, volunteers, policymakers. There are so many people. So they seek those voices, and then they encourage them to share their best practices, what's happening with webinars, podcasts, blogs, white papers. I've been part of several white papers. So we can all learn from each other, right? Because we all have the same goal, ultimately, is to improve the human experience in healthcare. So one thing, just one example, when everybody shut down with no visitors, which we all know was really bad for the patients, for the families, the Beryl Institute sought out people's ideas around that going forward, and a paper was created that talked about the outcomes that safety was reduced when you don't have visitors. And they did data on this, they did interviews. So when my organization with the last surge thought about closing down again, I brought this article, and that got them because it talked about safety and specific examples of how safety went down when there weren't visitors there to support. So that's just one learning, but there's so many out there from the pandemic.
Kim, do you want to mention about the white paper?
Oh, yes. So I have a bunch of copies up here, so if you're interested, you can get them from me, or I can leave them somewhere. The Beryl Institute did with a bunch of people from the organization, some people from these groups, a white paper called Patient Advocates: Expanding the Landscape of Patient and Family Support. It highlights independent advocates, hospital-based advocates, got interviews. It's a very good white paper, so you can use this QR code and get the paper. They give you the code to get it for free. So if you're interested, grab one of these. I think you'll enjoy it.
Great. Colleen?
I think the one takeaway from a case management perspective is it really opened everybody's eyes to the use of telehealth. The Veterans Administration has been using telehealth very successfully for over 20 years. And every time it comes up at a federal level, at a state level, it's like, well, no, we don't know how to reimburse that. Oh, no, that's not a real visit, blah, 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 blah. Hey, guess what? It really pushed us to moving into a virtual world where, all things being equal. And we were able to show and to prove that the telehealth platforms actually can work, not necessarily as a substitute full-time for in-person visits, but for supporting people with chronic conditions, absolutely. That being said, that's one of the great takeaways from it. But the other one was, shifting things to virtual so that we can reach more people as an organization. Our membership, can't all get to where we need to go. Now we're crossing borders and attending everybody else's meetings. I just did a presentation last night, and I did not fly in this morning from Chesapeake, Virginia. So, I was able to do a presentation for them last night, and it was an incredible opportunity to be able to network and find out who else is out there, what else is out there, and what we could do together.
Great. Heidi?
Well, first of all, I'd like to, again, thank you for inviting us. PACB marked 2 milestones today, and since this month, actually, since this is a leadership panel, I'd like to acknowledge some of the leaders who came before us and on whose shoulders we are actually standing, because there are at least 2 people in this room who were present during the founding of the PAC board 10 years ago, and that is Ann Llewellyn and Beth Droppert. And who came, at least that's what I found in the paper that was given to me. Shortly thereafter, people like Iodolka joined. Tricia Torrey was part of it. Deb O'Connell, Jerry Hollenbach, Kate Rowe, and Vicki Breitbart are all people who I feel we owe a debt of gratitude to. And so, thank you.
And Heidi, there are some people from the PAC board here that will be at your booth today. Melissa Cardine, I know Chris North is here.
Yep.
Chris North, and Danielle Marshall.
Yes.
Danielle Marshall.
Most important person of the PAC board, Danielle Marshall. Quick silver lining for us was probably being forced to go to all remote proctoring. Once all the test centers shut down, we had to scramble to find a different partner, and I must say we're very glad that we did, because the new platform that we have is it's much easier actually and more integrated, and as time goes by, I think people will find it very, very user-friendly. So that's been a silver lining for us.
Stacy.
Thank you. I would say the silver lining for us is, for NAC as an organization, is the increased use of technology and the ease with which we can now all Zoom. It's helped us certainly as a board be able to work more effectively and efficiently together. It's also helped us to connect with our advocate colleagues, because I don't know, I remember prior to the pandemic, 2018, 2019, we were still having conference calls. If you guys can remember back to that experience. And for me, those were horrible. I found those to be very inefficient, very ineffective. So I personally am delighted with our ability, that really everybody was able to make that step forward and become comfortable with having a Zoom meeting, become comfortable attending a networking event where we're all in our Brady Box bunches. So I think that's been a really wonderful silver lining.
So from the Aging Life Care Association perspective, we too really jumped into the whole use of Zoom. I found that from the very beginning, the association started having meetings and opportunities for the care managers throughout the country to get together to really share how to to pivot, as we hate that word now, but really figured out how to pivot together to better serve our clients. And so we really use that Zoom platform, and we've continued to do that. So we have different monthly meetings for our solo practitioners and for our small business owners and for our care managers that are supervising other care managers. And so we have these monthly meetings now that came out of the whole pandemic and came out of the opportunity for our association to really work much more closely together. And we are spread, like you all the patient advocates are spread out throughout the country. This has given our care managers the opportunity to really connect, share information, and learn from each other. So I think it's been a great opportunity. And then, unfortunately, it was through such a horrible occurrence throughout our country to get together better. But we are all better together.
So the pandemic for Health Advocate X was really defining and emerging for us. And so we're headquartered in Seattle, Washington, as many of you know. And we are a not-for-profit organization focused on helping patients transform from a patient to an active participant and partner in their own care. And when the pandemic started to erupt right from our hometown, we really took a look at where we sit and what we could do to have impact to patients and also advocates. And I just wanted to say that this is also connected to our name. And some people, question, what's the X for and what's all that about? And if you haven't attended our previous conferences, the X stands for every individual patient's experience. And it is superset above health advocate, because when you put a health advocate in front of the patient experience, then that patient experience is improved. That's the idea behind the name. And so we were very fortunate to have on our board Medical Director Dale Reisner from Swedish Health Services, who is an expert in virology. I know that many of you have attended our community conversations, which started weekly March 30th of 2020. We basically pulled that together very quickly, and with the leadership of Beth Droppert and other folks on the board and Dale Reisner, we were able to give timely, credible, and actionable information directly to the public, but also through the lens and to help advocates navigate what was emerging, what was truth, what was not truth, what could you do, what were some very specific strategies. So for our organization, it was very transformative. We were able to do weekly, and then now we've been doing monthly community conversations about the pandemic and be able to deliver specific health advocacy content to you and the public, which we continue to do.
Definitely. And Beth, Robin, I did myself listening to those webinars, and it really helped break through some of the I guess, chatter that was happening around on the news, in our newspapers, in our community, and helped us get, like you say, credible information. So that was so important. And to be able to share that, like tell other people, the consumer, to listen to this, tune into it. It's free.
It is free, and I was just going to say that. It's free. Our next one is May 10th. But it is really through the lens of what all of you are doing every day. So we try to kind of straddle both those lines between making it simple enough for the general public to understand and have value, but also you in what you're doing in your very important role. May 9th, sorry, May 9th, Monday, May 9th. After Mother's Day.
I'm going to let Tricia speak to AFA because I wasn't there during the pandemic, although I guess we're still officially in it. But I would just make a broader observation about the world in the US in particular, that the crisis created so much vulnerability among people that the government had to act. And politics aside, although it won't be hard to figure out where I fall, the government had to take action to protect people. I spent a decade in a Medicaid health plan, and most of that time was spent trying to get people back onto benefits they were entitled to after they got booted. And the policy at the policy level, there was a recognition that there had to be protection for people. Legislation made it easier to get benefits, and policy steps or regulation made it easier to keep those benefits. And I think that just thinking about the people we all care about, so everyone, people need to have access to insurance in order to get the health care they need. And the battles that many of you fight every day involve the insurance policies. And I was just having a conversation with somebody, how do we get onto Medicare? How do we choose a plan? Those very fundamental sort of coverage issues got just one hair easier for a lot of people. And I hope that we recognize how important that continuous coverage is. And then for us, for the advocacy world, that will hopefully make things just one hair easier for the people facing all kinds of challenges on top of it.
Thanks, Deb. Trish?
So there are a couple of big picture concepts that I've dealt with in my lifetime. One of them is high tech, high touch. And I don't know if you have ever heard of that before, but it's the concept that the more high tech our lives become, the more we crave touch. And I found the pandemic was like this perfect example of that. So the approach that we took through AFA during the pandemic was to empower our members to do as much high touch, even if high touch meant Zoom. And for two reasons. One, we had many, many new people who were just trying to establish practices. They felt like they were behind before they could even get started because all of a sudden they couldn't call on the people they would typically call on to help them out. And so we tried to encourage a lot of creative thinking. And I have to say, that's my second concept. People rose to the occasion in ways that I couldn't imagine when we got started, and started sharing things that they were doing a little bit differently because they now had one arm tied behind their back. They were teaching their clients how to use Zoom. They were teaching people in nursing homes how to use an iPad to do FaceTime with their grandkids. And all of a sudden there was more high touch than there had ever been when these older folks were waiting for somebody to show up to visit. And so I try to keep that in mind, that yes, the pandemic has been extremely difficult for all of us, but we as a group of patient advocates rose to the occasion. And I'm so proud to be associated with a group of people who were able to do that so effectively.
Excellent. Any comments from the audience? Please use the microphone. We would love to hear from you. Come over to the microphone because we are being taped, so we need you to be on the microphone. But yeah, all of the organizations, and I hope from this that you'll go and check out every organization to see what they're offering. Lee?
I knew about the record company. Does anybody else know that he loves rap, by the way?
I know. I never did.
Lee, introduce yourself.
Sure. I'm Lee Mueller, and I'm a health advocate. I'm also on the PAC board. I've been on the NAC board, so I love seeing everybody here in person. And I think one of the biggest differences that I saw in how many of us practice, I'd always had a national practice, so I was kind of used to doing things at a distance with my clients and knew how to relate to them over the phone, not necessarily on Zoom, but over the phone. But I found myself teaching other people how to do that because so many people are like, oh, I can't work with my clients because I can't take them anywhere. I can't go with them to the hospital. I can't be with them there. And so I found myself teaching people how to do that. And I was really fortunate to be part of a panel of some of the best of my colleagues here, which I loved. I got to meet them and learn about them. This is the first time I'm meeting some of them in person, talking about the pandemic from really early on. We did our first one in April of 2020. And EO actually organized it. I wish she could be here, but she's in Greece. And it was so, we were trying to help other health advocates think about, so what do you need to do to pivot to be able to address this? What do you need to know? What do you need to know about what's different that's going on in different parts of the country, in Seattle, in Houston, in New
Florida.
England? So there were a lot of different things happening.
Thanks, Lee.
Sure.
Hello and good morning. I'm Dr. Karen Reynolds, and this is my first patient advocacy conference.
Welcome.
Thank you. I started my business, Caracowell, in December 2019. And so I consider myself someone, I love hybrid, I love online and things like that. So I always had planned to incorporate that into my business. And so what I'm finding that I am having difficulty with structure as far as when I get the clients, the intake, and how to streamline that, because I do believe in weeding out. So I do offer like a free 15-minute conference, consultation just to see if they're a good fit, if there's somebody I can work with. But after that, when you do the deep dives and then you come up with the pricing, it's a little difficult and confusing to do that. And one of the things that I wanted to do when I came to the conference to ask this question is because you are experts. You've been in the industry a long time. You were there before the pandemic and after the pandemic. So there may be others like me. If you can just offer some advice on what structures have worked for you, because my company, I do plan on taking it, it is international, and so although I do service everyone, I do specialize in LGBTQ and same-sex family advocacy. So if you can offer any advice to some newbie like me, that would be grateful. Thank you.
Heidi or Stacy, do you want to address maybe setting up their business? I will, Tricia, come to you.
Sorry?
No, go ahead.
Sure, yeah. It's a great question. It's a popular question. It's a question that pretty much all of us struggle with during our first couple of years in practice. I find that many people, myself included, initiate our practice with one set of ideals, and then we kind of say, this isn't quite working. I'm going to try something a little bit different. And we kind of shift and weave for a little while before settling on what really feels good to us. So I think it's hard to give one general answer. I think a great way to go about it is to continue talking with your colleagues, and I think this is the perfect, platform for that, and I'm so glad that you raised the question, because I can guarantee you that there are many others in this room who are struggling with that same issue. So I would encourage you to continue talking with people, continue exploring other ideas for how you want to conduct your intake process, for how you want your potential clients to contact you. That initial contact is often a really key moment in establishing your relationship. And what do you want that to look like? Do you want them to email you form? Do you want them to call you? How do you want to set up that initial contact that you will have with them? And then there's thinking through your pricing structure. Some people really like to take a retainer. I resisted that for the longest time, and then I finally came around and said, you know what, I need to take a retainer. So these are things that you will continue to think about, more, discuss with your colleagues until you really find the best solution for you. So I'm certainly happy to talk with anybody about my journey and the things that I explored personally in my business, and I know many of my colleagues are as well. So I would encourage all of you to who have these questions to reach out to us, because it's through these conversations that you'll begin to feel what's going to really work best for me. Yeah.
Deb? No, Deb Gordon, I'm sorry, Trish. Deb Gordon.
She was,
I mean, Deb
she's
Feldman.
ceding the floor, she says.
Deb Feldman, I'm sorry, Deb Feldman.
So, so the Aging Life Care Association has worked really hard to develop business programs and courses, which they hold throughout the year. There are packages that you can participate in. And then usually prior to the day before our annual conference, which we just had, we'll have a couple of sessions that are strictly to help people develop and start up their businesses. The other thing in addition to that, we do offer mentoring programs, so you can, come to or reach out to the National Association and ask to be paired up with a mentor, and a lot of times we'll have those partnerships in different cities so that there's not that feeling of competition, because sometimes people have that attitude that I don't want to work with a colleague of mine that's in the next suburb for fear of that competition piece. But you can informally, and I have done this throughout my career. I've actually been working as an aging life care manager for well over 30 years. Was kind of on the cusp of the pioneers. I can't say I was a pioneer. Came in shortly after that, but I have mentored other care managers, and it's been very informal. Sitting at a conference like this, sitting and talking to somebody that was getting their business off the ground, and I'm more than willing to sit and talk with somebody and kind of share some of the best practices that I have, and that's what these conferences for all of you are all about too, is find another patient advocate or find a care manager and sit with them and see if you can informally set something up.
Trish?
So Karen and everyone, there is a concept in business called the minimum viable product. And what the minimum viable product means is just get started. Your practice is never going to be exactly what it's going to be tomorrow or next week or next month. So what you do is you get started, and then you figure out how to adjust based on whatever challenges come your way. So you go ahead and you take that first client, and then you say, oh, you know what, I really need a better way to get the signature on the contract and to get that first paycheck or take a retainer, whatever it's going to be. So for the next client, you figure out how you're going to do that. So that's your second person, but you've gotten started. And until you get started, don't look for perfection. There's this whole thing about people want things to be perfect before they launch. No, you'll never launch because it'll never be perfect. So just go ahead and get started. Those of you who've been in business for more than 2 years, are you with me? Do you agree with me? Yeah. All right. So that's what you do. And then there are courses out there. Practice Up offers courses. Talk to Deb. You've got a coupon, right? Yes. Yeah, there's a coupon for people to get, yeah. For this show only, and you got to use it by the 1st of May. You have to buy it. Buy it by the 1st of May. You just log in and pay for a course, and then you can use it. But the point being, do not wait around until everything seems like it's perfect. Just get started.
Go ahead, Heidi.
I echo what everybody else has said, but also would say follow your gut, because your own response to the person, the fit is both a two-way street. And I'd also recommend really finding and seeking out your colleagues. There are now a lot of regional groups. I am a practicing advocate in Massachusetts and belong to MACA, the Massachusetts group. That's a regional group of NAC. NAC now has mentorships, and it's really easy to call up one of your colleagues, or we do weekly chats within MACA, and sometimes we talk about this, and I frequently ask, have you spoken to any other advocates when I'm not sure I'm what I'm hearing on the other end, and so on and so forth. So,
Brad?
I also agree with everything that everybody said. But one of the things that I've been focusing on lately is really trying to encourage people to get on there. And I mean even the ones that are stepping away from the practice or stepping back, because when people are calling an advocate, they're really trying to get out of that formal healthcare system. They're fed up, they don't have answers, it isn't working. And if you pick up the phone when they call, I'd have to say, at least in my experience, there's more than a 50% chance that it might not be you that's going to be the one that is going to end up helping this person. But when people are struggling within healthcare and they're making that call to get help outside of healthcare, we need to be there. And it's okay to answer the phone and hear the story and say, you know, it's not really for me. However, I'm part of a group, I'm part of these networks, I would like to just make a referral to you. And that's as much the job of an advocacy professional as doing the nuts and bolts. So I just, if you're not ready, get ready. And if you are stepping away, consider sticking around a little bit to be a resource. You don't have to do all the work. I know that there are pioneers and people are stepping away. But the only way for us to really grow as a profession is to show those strength in numbers and let the public know that there are these leaders and pioneers out there. Don't go away, guys.
Great. We have a question from the audience?
It's not actually a question, it is actually a comment. You asked about the pandemic. And first of all, let me introduce myself to everyone and say good morning to everyone. My name is Sandra L. Washington. I am the managing partner of MediHelps LLC. We have been active on Clubhouse and other social media platforms for about a good year and a half. And I've actually served as the patient's voice, because the patient's voice does need to be heard. We also need to look at it as the pandemic, while it really did cause a lot of harm in the communities that I service, that I predominantly service, it actually brought the limelight on diversity and inclusion into where it should be. No one should be excluded from receiving excellent, optimal health care. We all have to put the spotlight on all, not just the chosen few, not just those that are benefiting from whatever services that are available. We have, and especially today, we're on Rare Decisions Day. There are a population of minorities that are often overlooked. That shouldn't be. You have African American and Spanish people who don't understand what insurance is, that need someone to explain to them what insurance is, how this whole healthcare system works. So when we look at the pandemic and we look at the opportunities that are among us, we're nowhere near the end of this pandemic. We all need to come on board, all hands on board. I've been fortunate enough to be introduced to L. Brad Schwartz. We've collaborated on plenty of occasions doing clubhouse speeches, trying to get the word out that patient advocates are an independent, and bring limelight to what exactly is an independent patient advocate. But we've brought as much limelight as we can. But I'm asking all of you in this room, each and every one of you in this room, that before we move forward, we move together and we come together and we work on inclusion of all, not just the chosen few. Thank you so much.
Thank you.
Good morning, everyone.
Good morning.
Good morning. So my name is Oksana. Thank you all for having us. And I wanted to comment and also respond to Dr. Karen's question. So the initial question that you asked, and yes, I kind of wrote a speech because I'll forget everything that I have to say. The first question, though, how has the pandemic kind of changed or opened up our eyes to in regards to advocacy? And I think that what this has done for me is it's given me a more creative insight. So many of us have talked about, kind of going technology and working through Zoom and things of that nature, but this has really forced me, and I'm sure other people can relate, to find more creative ways to communicate what it is that you want, right? So YouTube University, graduate, top of the class, hello. But really just finding different ways to communicate with people, finding different ways to get your point across, finding different ways to obtain the knowledge, to learn. Even just being here was through creativity. So the pandemic really caused uncertainty for many of us, right? We didn't know if we were gonna have jobs, people were getting laid off left and right, and so that led me into saying, well, how can I create a level of certainty for myself that is also going to be fulfilling? We're in the Great Resignation. I quit my job in November. I worked for United Healthcare. I worked there for almost a decade, and I realized that I had gained so much information, so much knowledge from the payor side. I moved up very, very quickly from benefits into claims, and I was the bad guy for a while, and then I moved into appeals, and I became the good guy, and now I want to be the superhero. So I started my own advocacy service with a focus in health finance. So that's what I do. We have many clinicians that are here, and I really appreciate everyone who is here and able to help our patients and our clients get the service that they need. Who's going to pay for it? Who's going to pay for it, right? If they don't understand their benefits, much to Ms. Sandra's point, if they don't understand insurance, they don't understand a deductible, they don't understand that flexible spending account, you can use that for something over the counter, right? They don't understand that you can be reimbursed for mileage to and from your office visits. They don't understand that you can actually pay for medical transportation to your visits and that you don't have to call an ambulance that's out of network and get an $800 bill because you had no other way to get to the hospital and you didn't go to your doctor's office because you didn't have transportation or reasonable access to care, right? And so you just let your issue progress and progress and progress until you end up in the ER. Your hospitalist is out of network. Your emergency physician's out of network. Your radiologist is out of network. You don't even know what a network is. What's a network, huh? What's that? And so really being able to, that uncertainty has really helped me in that I realize that there really is a need for our services. Yes, people need clinicians. We absolutely need you guys, but people need money. People need to know, much to, I believe, I'm sorry, I can't, Deb, is it Deb? You had mentioned something along the lines of that collaboration. And so I recently heard of BCPA. I am board certified, and shout out to everybody else who just got certified. Woo woo, round of applause. But for me, that simply has opened up an opportunity for collaboration, to your point, right? I'm very grateful to see that we're all here. We should not all be here to support each other one weekend out of the year. We should be there consistently for each other. And so as a result, I have started a Facebook group called the BCPA BFF. And that's, right? My business, Omni Advocacy, I am not your health advocate. I am your healthcare bestie. That's what I'm here, because I'm not here to talk over you. I am here to talk eye to eye with you. I'm making eye contact with many of you in this room because that's the level of service and that's the level of care that our healthcare system needs, and that is what I intend on presenting. And so, Dr. Karen, to your point, this community that I am building, called the BCPA BFF, is what is going to allow us to just jump on Facebook group. Hey guys, so your question that you just posted, right? We've got answers from 1, 2, 3, 4, 5, I can't count right now, I'm just gonna say 8 people up there, right? But you have maybe 100 people in here. On that Facebook group, you could post your question, you would get 100 different answers from 100 different perspectives, from 100 different things that people have tried. And then you have that platform to make a decision on what works for you, what do you think could work, who should I connect with, who can I ask more information, hey, I wanna pick your brain, and we build from there. And I think that, the pandemic has truly, Facebook groups is a thing now, right? Facebook groups have been out for a very long time, but I say all of that to say the pandemic has really opened up my way and my eyes to being more creative and being able to connect with people outside of necessarily Zoom.
Excellent. Elizabeth?
Hi, everyone. I'm Elizabeth Bailey. I wanted to ask the panel for their observations and reflections on a couple of things that I've thought about during the pandemic, both on a micro level with, private patient advocates, individual patient advocates, but also just as a profession. And it speaks to part of what Trish is saying in the kind of high-tech, high-touch, and low-tech versus high-tech changes. One of the things I was thinking about, and anyone who knows my work knows that I primarily have focused on where I think the rubber hits the road, and that's hospitalizations for most patients, because that really brings people headlong into the brick wall of our healthcare system. But I was thinking about this, and one of the things I think the pandemic might have ushered in a low-tech way is hand hygiene in the hospital setting. Because when you think about pre-pandemic and the statistics of frontline healthcare providers that, less than 40% wash their hands in between patients, and it's how that contributed to, hospital-acquired infections. It would be interesting to see if something as low-tech and as culturally seismic, like it made us all wash our hands. That's one thing. It's like, have any of you seen shifts in that way? But the other thing, and it speaks to high-tech merging with restricted visitations in hospital settings, which I think is here to stay for many reasons. One of which is, I think that, hospitals are bleeding nurses. They're leaving in droves. And I just wanted to remark on a situation. I worked with a friend, but as both her friend and patient advocate, she lived alone. She likely got her master's in healthcare advocacy at Sarah Lawrence, and 2 weeks ago she had pancreatic cancer surgery. I was the one person who could be with her. They only allowed visitors from noon to 8. Of course, her doctors rounded at 6 a.m. The nurses told me they were consistently short-staffed on this new wing at NYU called the Kimmelman Wing, which each room has a 70-inch flat TV and an iPad where you can call your nurse. But there were 2 nurses on the floor the whole time, and 4 of the days we were there were no aides because they called in sick. So she would have to wait 2 hours to get out of bed. Her pain medication was consistently late. And the hospital, I think the C-suite is thinking, we have this technology now. They can just, and I said to one of the nurses, is someone really honestly my age who's just had major surgery? I'm not going to be like, oh, where are my reading glasses? How do I do this, the iPad to get a nurse? And so there's this, I think the telemedicine holds so much promise, but I think it can also be like this Trojan horse that where patient advocates, I was there when I was in the hospital, I was thinking, what is it that the gatekeepers don't want professional patient advocates to be involved, to intersect with us in a way where we're not working against them, we're working with them towards better care for patients. So I just was wondering if any of you had.
Thanks, Elizabeth. Yeah, we do have 2 leaders that are in hospitals. So, Kim?
So that was a lot of information, a lot of good information. The one thing I want to quickly focus in on for us, you guys know that staff are leaving because of this pandemic, that nurses are retiring early and doctors, so you're right, there's this been kind of exodus. We did identify that. We didn't try to use technology to supplement that. But as an organization, we got together, we created quickly a program called Helping Hands. We had our therapists on the floors helping nursing. I took shifts. I'm non-clinical, but I can pass the tray and I can answer a call light and find out what they need. So we really mobilized quickly this helping hands, and we set it up in a way that if we need to mobilize that again, we will. But we identified that we needed to support on the floor with those patients. You know, I wanted quick to talk about independent advocates and hospital advocates and case managers. And from my perspective, we don't do a good job, for sure, of integrating all of those